right, well, hi everybody. Thank you for letting me come and talk to you guys today. Like they said, my name is Candice. I'm the new dementia care specialist for Milwaukee County. I'll kind of be talking a little bit about like my role, brain health. So I always like to start with the mission of Milwaukee County. And our mission is to affirm the dignity and the value of older adults living in our community, encouraging them to live and give to our community. Most people, I'm sure, are familiar with Milwaukee County Department on Aging, but we serve as like an access point for older adults who live in the community to access resources and services that they need. We have a no wrong door policy. You can call us at any time with any questions that you have. We'll do our best to answer your questions, or if we just don't know what the answer is, we'll get you connected to that person who can help you. So that no wrong door policy. Okay. I also like to go over the services that Milwaukee County Department on Aging provides. We kind of divide it into two different groups, so the quality of life needs and then the vital life needs that every person needs to live. So starting in the quality of life, we have a variety of different wellness programs. I'll be going over those different programs that we're offering right now later in the presentation. They're free to take to anybody who lives in Milwaukee County who's resident. And then of course we have our county-owned senior centers. Some communities have their own community senior centers, but we have 5 county-owned senior centers. We have our senior dining sites, which we have about, I think 24 or 26 different dining sites located throughout Milwaukee County. Anybody who I think is 50 and older can go to the dining sites. And you don't have to pay anything to go for lunch. It's one hot meal. They have a suggested donation of $3, but you don't have to pay if you can't, or you can pay when you can. And then, if you have trouble maybe getting to those dining sites, we also offer transportation as well, which is the next one on my list. So we provide the Go Pass, bus passes, a lot of variety, different types of transportation options for older adults. And if you're ever wondering what maybe different transportation options are out there for you, you can always call the call center and they'll go through those different transportation options with you. Of course, we have our Meals on Wheels. That's for somebody who's maybe homebound, who can't get out to those dining sites. So they're still getting nutrition. They're still getting that hot meal once a day, Monday through Friday. We also are the access point for long-term care programs, which provides, home, care in the home, case management, home services, personal care, things that you might need, home modification, stuff like that. We have our elder abuse unit, which anybody can call in anonymously if they think somebody might be a victim of elder abuse. And then of course dementia care, which is me. Dementia care specialist, so this kind of sprouted, this position sprouted from the Wisconsin Dementia Care redesign. And we came about in about 2014. So the counties that are kind of highlighted in that like purplish color are counties that currently have a DCS. They're looking to put more of us in different counties and eventually have a DCS for each county throughout the entire state of Wisconsin. But we have about 24, 26 right now. And then kind of these are the main pillars of my job. So one, create a dementia capable ADRC. Create dementia-friendly communities so people who are living in the community who have dementia can access things that they normally would access with ease. Met with understanding. The employees, the other people in the community know how to interact with them and work with them, so it's a better experience for everybody. And of course, support people who are living in the community with dementia and their care partners. So their wives, their kids, that neighbor who are all working together to care for this loved one that they have who has dementia. So one of my biggest roles is to support them and provide them with resources, support, information, and guidance on how they can be a better caregiver and they don't burn out. I also like to talk a little bit about what dementia rates look like currently right now in the state of Wisconsin. So currently we have 120,000 people identified with a dementia diagnosis right now. At age 65, 1 out of 9 people will have some form of dementia or dementia diagnosis. At age 85, that odds increases to 1 out of 2 individuals living. So if you make it to 85 and the other 85-year-olds around you, half of you guys will have some form of dementia. Also too, dementia is the 6th leading cause of death in the United States right now. By the year 2020, so that would be next year, we would have enough people living in the state of Wisconsin with a dementia diagnosis to fill Lambeau Field and Miller Park at the same time. So that is a lot of people, and Wisconsin is increasingly working to, they know this is coming, and they want to have supports in place and care in place, because we can't have this big mass of people who have dementia without access to care that they need to stay in their homes or have guidance of, I can't stay in my home anymore, now what? So it's a process, but we're working on it. And also too, 70% of people who do have a dementia diagnosis actually stay living in the community. They stay living in their homes for the progression of their disease. Most people think like, oh, once you have dementia, you go to a nursing home. And that really isn't the case. And my goal is to keep people in their homes and to bring in support so they can stay there where they want to be for as long as possible and cross that bridge if they have to move when we get there and kind of plan for the future. Okay, so what is dementia? We've been hearing a lot about dementia in the news and everybody kind of knows what it is, but I kind of really like to put a definition and define what is dementia. So dementia describes a group of symptoms associated with memory and other cognitive thinking skills that are declining. So for a person to be considered to have dementia, the following criteria must be met. So 1, 2 or more cognitive functions must be impaired. 2, it's a change from their baseline. That's very important. So it's a big change from their baseline. It affects their day-to-day life, so it affects their ability to do the things they need to do every single day. And then it's not caused by something else. So it's not caused by maybe depression and an infection, and I'll go into that a little bit more later down in the presentation, but that's the first thing that professionals and doctors should do, is just ruling out if it's being explained by something else. There are many different types of dementia. There's actually over 50 different kinds of dementia. A lot of people don't realize that there are that many different types. I just kind of highlight some of the more known types of dementia. So number 1, of course, is Alzheimer's disease, Lewy body, frontal temporal dementia, vascular dementia, and of course the treatable dementias. I'll be going into a little bit more about Alzheimer's because it is the most common, and then I'll also be going into those treatable dementias as well. Okay, this is just a nice graphic that I found that just really kind of puts a picture of what dementia really is. So again, it's that umbrella term. So the first thing I normally ask families when they come and they talk to me, they're like, oh, my mom has dementia, you know, she's having this, and this symptom, or doing this, and this odd behavior. My first question is usually, well, do you know what type of dementia she has? And they're like, no, she just has dementia, but dementia is, you know, that umbrella term describing a group of symptoms. I want to know what type of disease is causing her dementia symptoms. So does she have the most common, which is Alzheimer's disease, that accounts for 60 to 80% of all dementia cases? Does she have vascular dementia, which kind of pairs along with if somebody has a stroke, they have a very high risk of getting vascular dementia. Do they have Lewy body? Do they have frontal temporal? That one's a little bit more rare. That accounts for maybe like 10% of all dementia cases, but specifically that one, it's becoming more and more diagnosed, and that one too also happens earlier in your, like it doesn't happen normally in like your 60s, it accounts like normally in your late 50s, so it happens when you're younger. Okay, so I'm going to dive a little more into Alzheimer's disease. Like I said, it is the most common type, accounting for 60 to 80% of all cases. It's a type of dementia that develops slowly over time and progressively gets worse. And then those symptoms become severe enough to interfere with things that you need to do every single day. So being able to make appointments, go to the doctor, go grocery shopping, make that list to go grocery shopping, drive there. So when you actually like break it down on how many steps you need to do something during the day, this really starts to affect that. Usually the first symptom is memory loss, so that's usually the first sign that somebody might be developing Alzheimer's disease. But some of the later symptoms that people sometimes don't associate with Alzheimer's disease is they have maybe impaired communication, poor judgment, disorientation, confusion, difficulty with speaking, swallowing, issues with their walking. So as the disease progresses, it starts to affect other functions of your body and your other cognitive abilities. Okay? I always like to show this too, because it really gives a picture of what Alzheimer's does to our brains. And I'm going to ask you guys a question. So, looking at these two brains, what do you notice between the left side and the right side? What are some differences that you notice? It's shriveling. It's shriveling. What else? It's deteriorating. There's these weird gaps. Certain parts are missing, like down here, gone. So these two brains were actually the same age. The person was the same age. They were the same gender. Everything about these two people were exactly the same, except this person had severe Alzheimer's and this person did not. So a lot of people forget that Alzheimer's disease is a fatal disease and it kills the brain. But it's hard to recognize it because you can't look at somebody and be like, oh, you have Alzheimer's disease. You can see it after they pass away and you look at their brain, but yeah, so what doctors do when they're doing their testing, which I talk about that too a little bit later in my presentation, but I'll talk about that now, is they do different scans like a CAT scan or a PET scan because they're looking at the activity in the brain, so which areas are active and which ones aren't, and that kind of helps them narrow down like, oh, what type of dementia you have. So when they look at the activity in the brain, they'll see like, oh, this area is no longer active, there's a big black kind of hole here. This pattern of this brain scan looks more like Alzheimer's disease. So this next thing that I like to show is it's a very nice video that kind of guides you through what Alzheimer's does to the brain and kind of how it works its way through the brain, the different areas it affects, and what that means for you as a person.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination, and in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady, and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
Does anybody have any questions after that video? Did anybody learn anything new that they didn't know about Alzheimer's before? What did you learn?
About how it goes through the brain.
Mm-hmm.
Death in the cells.
Yep, it works its way, and then depending on where it goes in the brain, those are kind of the symptoms that you'll see in somebody who has Alzheimer's. So if it makes its way to that language section of your brain, you'll have issues with maybe talking, word finding, understanding what people are trying to, to communicate to you. So if you might say like, oh, can you go get me a fork, and they bring back a spatula? Or, oh, can you tell me like the sound a dog makes? They might go moo. So their brain is losing those connections, and they're trying to fill it. Okay. All right, so the next thing I want to talk about is kind of those reversible or treatable dementias. So these different things can kind of mimic the symptoms of different types of dementias. So some people get misdiagnosed with dementia when it's actually one of these treatable conditions. So for the first one, for medication, so if your doctor puts you on maybe like a new medication or makes an adjustment to it, you might have a bad reaction to it. It might look like a symptom of Alzheimer's, but maybe it's that medication interacting with something you're already taking. And sometimes too, if a doctor puts you on a new med and it's not working, communicate that to them so they can try something else or maybe adjust the dose. Depression. In older adults, depression really mimics the symptoms of dementia. And treating that and going to the doctor and getting diagnosed and treating the dementia or the depression, that will make those dementia-like symptoms go away. Other medical problems, hearing and vision impairments, vitamin deficiency like vitamin B12, infections, sepsis, UTI. When an older adult has a UTI, they normally get delirium, or they can get delirious, which looks like dementia. So sometimes a family member calls me and they're like, oh my gosh, my father's dementia really flared up last night. And I was like, what? She's like, yeah, he just got really confused during the night. We don't know why. And I was like, well, he might actually have a UTI, so you probably want to take him to the doctor to get him checked out to make sure that he doesn't have that, because once they cure that UTI and make that go away, he'll go back to the baseline of where he was at before.
What is UTI?
Urinary tract infection.
Oh.
Thank you for asking. That's the trouble with acronyms. When you use them, not everybody knows what they are. So if I'm talking about something and you don't know what it is, flag me down and be like, wait, back up. The next thing I want to talk about is some risk factors for Alzheimer's disease. So the first thing I want to talk about is who is at higher risk of developing Alzheimer's disease. At the bottom, women. Unfortunately, we're just at higher risk because we live longer. The number one risk factor for developing Alzheimer's and other different types of dementia is age. So the older you get, the more at risk you are of developing the disease. And because we usually outlive men for whatever reason that might be, we're at higher risk of developing the disease. And then also Latinos and African Americans are at higher risk too. Latinos are 1.5 times more likely, and then African Americans are 2 times more likely than whites to develop Alzheimer's disease. And then that is because of some of these risk factors over here on the right side, because they have higher rates of diabetes, blood pressure, high cholesterol, heart disease, and stuff like that. So because that population has these higher rates of these diseases, they're at higher risk of also developing Alzheimer's disease. But like I said before, age, so the older you get, the more at risk you are of developing Alzheimer's disease. So if you make it to 65, 1 out of 9 will have it, and if you make it to 85, half of everybody living will have it. High blood pressure, high cholesterol. If you have a family history of memory issues or Alzheimer's disease, that puts you at higher risk of developing it yourself. Heart disease, diabetes, being a woman, unfortunately, Obesity and then inactivity actually puts you at higher risk of developing Alzheimer's disease. I also want to talk a little bit about normal versus not normal aging. So a lot of people come and see me because they just aren't sure, like, is this a normal part of aging? Is this what's happening to me? Is this normal? Is it not normal? I'm just not 100% sure. So I always like to kind of like go through some different examples of what normal aging and not normal aging would be. So on the left side there, so some normal aging things that happen as we get older. Maybe you just take a little bit more time to think, a little bit slower to process, a little bit slower to do things than you used to be. Maybe you're a little bit more hesitant on trying new things or just being a little bit more cautious. Sometimes you recognize that person, you know them, but you just can't think of their name. But if it comes to you eventually, you're still okay. Maybe sometimes you kind of pause and think before you're trying to think of that word, or trouble with word finding, you know, oh, that thing in the garden, it has like the 3 spikes, and you dig with it, you plant plants, and you're just trying your best to kind of find that right word. But if it comes to you, you're still good. And then sometimes you a little bit, you know, as you get older, you like to like reminisce on the past. That's a normal part of aging. My dad is getting a little bit older. He just retired. And he likes to focus on, oh, when you were this big, you know, like, oh, this picture I found of you when you were 5. And I'm like, okay, Dad, like, I'm a lot older than that now. Let's move along here. So then I want to talk a little bit more about the not normal side of aging. So maybe you just can't think the same as you used to. You know, you can't problem solve. You can't work things out. You kind of get stuck and you can't move forward. That's not a normal sign of aging. You can't do things like you did before. You can't get started. An example would be if you go to your car and you get there and you're like, oh, I forgot my keys, and you go back in and you get them. That's a normal sign of aging. But when you get to your car and you're like, I don't know what to do next. Like, you forget that you need your keys to put them in the lock to open it to start the car. That is not a normal sign of aging, and that would be a big red flag. Let's see, you can't place the person, so somebody that you've known for years and you don't recognize them at all, that's also a big warning sign. The word won't come to you even later. You know, sometimes it takes like a few minutes or maybe an hour and it'll come to you later, but when it doesn't come at all, that's a red flag. And you start to get confused about the past and the present. They kind of start to mesh. And also too, confusion about place or season. Like if I went and I asked them like, oh, what season are we in right now? And they'd be like, oh, it's Christmas time. It's August, it's not Christmas time. And even if you say, well, look outside, does it look like Christmas? And they're like, yeah, like there's no snow outside. So there's some confusion about like the time and past and present. It starts to kind of all get mixed together. Oftentimes too, family members call me and they're like, you know, my dad is really starting to make up a lot of weird stories that just never happened. But what his brain is trying to do is, because his memories and things are getting wiped away, his brain is trying to make connections and make sense of things. So he's trying to form new memories. So it's not exactly fimming. His brain is just trying to fill the gaps. So I just want to go through the different 10 warning signs of Alzheimer's disease. So number 1. Memory changes that disrupt daily life. So one of the most common signs of Alzheimer's disease, especially in the early stages, is forgetting recently learned information. So maybe you start to use, you know, aids or, you know, like sticky notes or calendars to help you remember when you maybe were never a person who used those. So it's a change. I'm a person that religiously uses sticky notes, so I'm going to use sticky notes when I'm older. But if I'm a person who just never used notes, never needed it, I always could remember everything, and all of a sudden, like my house is like coated in sticky notes, that's kind of a big warning sign. A normal part of aging, though, is maybe forgetting something once in a while, maybe forgetting an appointment or a doctor's appointment you had, but you remember it later and you're like, shoot, I forgot my doctor's appointment, I'm going to have to reschedule it. Happening once in a while is normal, but happening on a regular basis is not normal. So the second one here, if we just go to the right side of our handy dandy little flyer, challenges in planning and problem solving. So some people might have a difficult time concentrating, taking much longer to figure out how to do things than they did before. I like to give the peanut butter and jelly sandwich example. You know, In your younger days, maybe you were a whiz at making a peanut butter and jelly sandwich. You did it in like 2 minutes flat. You toasted the bread. I don't know if everybody toasts their bread for peanut butter and jelly sandwiches. You toast it, you get the jelly on, you get the peanut butter, and boom, you're good to go in like 2 minutes flat. Now all of a sudden, maybe it's taking you 20 minutes. That's a big change, right? So that's kind of a big warning sign too. And if you see that maybe in your loved one or a family member or a neighbor, like, my neighbor, she was a gardening whiz. She could split a hosta, plant it in a different part, dig the whole 9 yards in like 5 minutes flat, and then all of a sudden she's taking like a half a day to do this one thing that she could do like that, a year ago. Something's going on. So something's going on. The third one, so having a difficult time completing familiar tasks. So people with Alzheimer's disease often find it hard to complete daily tasks such as maybe like driving, managing a budget at work, remembering the rules of a favorite game they always played. Does anybody know Mexican Train? Yes? Okay. So you just learned it here, but maybe it's something you played for a really, really long time. My grandma, that was her game. Whenever I would go and visit with her, we would play, she'd make me dinner, and then we would play Mexican Train while we ate our dessert. She never developed Alzheimer's disease, but a big warning flag would have been maybe she would have forgotten the rules of that game, and she knew how to play it like the back of her hand, so that's one thing to look out for. All right, the fourth one, confusion about time or place, kind of like that Christmas example. If you ask somebody, what is the season, they say it's Christmas time when it's August. That's a big red flag as well. Or what's the year? If you ask someone the date and they're like a few days off, that's not a big deal. If I was on vacation, you asked me what day it is, I'd be like, I don't know, I don't care, I'm on vacation. But to like look at the calendar, look at your watch to kind of know what date or what time it is. But when somebody's like way off, like it's 1993. Ooh, that's kind of a big warning sign because it's what, 2019? Yeah? Yeah. Okay, so the fifth one, they have trouble understanding visual images and spatial relationships. So they start to have issues with like depth perception, which can really become apparent when you're driving, trying to park, trying to pull out of a parking spot. Sometimes for people who have Alzheimer's disease, kind of in the later stages, if they see like a big dark hole on the ground, like a carpet or just like a rug, they'll actually walk around it because that looks like a hole to them. They can't judge the perception. They can't recognize like, oh, that's a rug, I can just walk over it. They'll walk around it because it looks like a hole. All right, so the next one, number 6. New problems with words and speaking or writing. So I kind of talked a little bit about that earlier when they start to have trouble like understanding what you're trying to tell them, or they have trouble communicating with you as well. So that's a big warning sign. Typically with age, if you have trouble finding the right word every now and again, that's okay as long as it comes to you later. But when you start to have those real big problems with understanding language, or somebody's writing, like my grandma always had really beautiful cursive, but if she started to get really messy with her penmanship, you can always get a little messy with your penmanship when you get older, but when there's a big change, that's a big warning sign. Okay, the next one, number 7, misplacing things and losing the ability to retrace your steps. So we have all walked into a room and you're like, what the heck did I come in here for? I don't know what it was that I needed. And it comes to you a few minutes later and you're like, oh, that's what I need. I needed a pen. That's why I went in there. But it's when you get stuck and you're not able to problem solve or work your way forward. Another example would be if you go to the washing machine and you don't know, like, oh, I need to put soap in the washing machine. You get stuck, you can't problem solve and work your way forward. That's a big warning sign. Okay, number 8, decreased or poor judgment. People with Alzheimer's disease may demonstrate unusual changes in their judgment or decision making. So for example, someone who maybe just never drove at night, like ever since maybe they turned 60, I can't see at night well, I just don't want to drive at night, I don't feel safe, and now all of a sudden they're going to like Potawatomi at like 11 o'clock at night on a regular basis. That's not like them. That's a big change from their baseline, and maybe that's not a good idea if they can't see well. So they start making kind of not thinking things through, kind of making bad judgment calls on a regular basis. Making a bad decision once in a while is normal. We all do it. We did it when we're young. We're gonna do it when we're older. But when it becomes a regular thing, That's a big warning sign. Okay, the next one, number 9. So withdrawal from work or social activities. So for example, if somebody was a really avid golfer and just that was their thing, they did it all the time and that was their favorite thing to, now all of a sudden they just don't want to do it anymore. They're not interested for no reason. It kind of came out of the blue, like they just, not from like maybe they hurt their foot and they just can't stand that long, but they just don't want to do it anymore. They're disinterested in doing things that they loved. That's a big warning sign, because that's not normal. Usually, I've met a I met a 99-year-old lady who still like volunteers at the food pantry like 3 days a week, and she's just as sharp as can be, but if all of a sudden when she's just like, I don't want to do it anymore, I'd be like, oh, something's going on. That's not normal. Number 10, so changes in mood and personality. So people who have Alzheimer's disease kind of also develop like personality changes. So for someone who throughout their whole life, maybe they were really a bubbly, happy person, really engaged, always like a social butterfly, and all of a sudden they don't want to be around people. Maybe they're a little bit more cranky. Like that's a big change from who they are, from who they've always been in their baseline. That's a big red flag. I feel like sometimes younger people sometimes forget that if you're a cranky young person, you're going to be probably a cranky old person. So that's not always the case if, just slapping, maybe they have dementia just because they're cranky. That's not right. Now that I kind of talked about the different warning signs of Alzheimer's disease, I want to talk about things that can maybe like reduce your risk. So it's never too late to pick up healthy habits or good behaviors to reduce your risk of cognitive decline. So aging well all depends on your genes, your lifestyle choices, your environment. This all impacts your cognitive health. So next I want to go through the 10 ways to love your brain. And this was put together from the Alzheimer's Association. So these are all 10 things that you can do to help improve your cognitive health. I mean, nothing is ever, 100% certain. Just because you do all of these things, it doesn't mean that you absolutely will never get Alzheimer's disease, but this will put you in a better spot maybe than where you were before. So everybody got theirs? Okay? All right. I was thinking about making each person maybe read it, but I won't. I'll read it for you. I always hated that in school when they're like, okay, now you're going to read. And you're like, please don't pick on me. All right. All right. So we're just going to kind of work our way around this flyer. And of course, this one is for you guys to take home as well, because I would love each one of you to maybe pick one thing that you could do out of this list and start incorporating it into your life. One thing, just one step in the right direction. But the first one that I'll start with is butt out. So smoking increases your risk of cognitive decline and, developing Alzheimer's disease. So talk with your doctor and see if you are, if you are a smoker, is there a way that you guys could, work safely to help maybe get you to quit? Or vaping now. If you vape, don't do that. Stop smoking. All right. And the next one is follow your heart. So risk factors for cardiovascular disease and high blood pressure, stroke, they all negatively impact your cognitive health. So make sure you're managing your chronic conditions, managing your cardiovascular diseases, your heart diseases, making sure that those are all managed well. The next one, heads up the guy on the little bike. Brain injury can highly increase your risk of developing Alzheimer's or other cognitive declines. So always wear a helmet if you're going biking. Does anybody here ride a motorcycle? No? Okay, good. Because if you do, make sure you really, really, really always wear your helmet. Always wear your helmet. The next one, the little apple, fuel upright. So eating a balanced diet that's higher in vegetables and fruit can help reduce your risk of cognitive decline. Has anybody heard of the MIND diet or the Mediterranean diet? There's a lot of studies out there right now that kind of link that specific diet to like just being healthier overall and improving your cognitive health. So it's a diet that's really high in like fruits, nuts and berries. Like you need so many different so many servings a day, but there's been a lot of studies on that. So if you're interested, go ahead and Google or ask your granddaughter to Google the MIND diet and send it to you so you can read more about it. Okay. The next one is catch some Z's. So getting enough sleep, but not sleeping too much. can help with problems with thinking and memory. Sleep is very important to us. It's the chance for our bodies to kind of like recoup from the day and kind of restore our fluids back to the different limbs, our joints, and our bodies. So sleep is very, very, very important. But on the flip side, you don't want to sleep too much. Right before I came here today, I was reading this article about how napping too much can be linked to developing dementia. So you got to have that right balance. You can't sleep too much, and you don't want to lack sleep from your life either. Okay, the next one here at the bottom, take care of your mental health. If you do suffer from maybe depression, anxiety, and stress, that really takes a toll on your body. It really takes a toll on your cognitive health, so you want to make sure that you're managing those conditions if you have them. If you're managing them well, you're putting yourself in a lot better boat. Okay, buddy up. So staying socially engaged, having support, being around other people, doing things that engage you with others, that really can improve your cognitive health. The next one, the little cards. So stump yourself. So you want to do things that challenge your mind, engage you. So maybe you'd want to start playing Mexican train or bridge, even though I've never learned how to play bridge. Or maybe you want to start gardening, just stuff that you enjoy that engages your brain and engages you as a person. Because I'm not going to ask somebody who just never loved math to do Sudoku. That would not go over well. The next one is break a sweat. So regular exercise can decrease your risk of developing Alzheimer's disease. So we're not asking anybody to be a marathon runner or do a triathlon or anything like that, but just incorporate maybe like a daily walk around the neighborhood or do those leg lifts every time there's a commercial on the TV. Something, just start slow and start little and work your way up. Just, the healthier you are as a person, the healthier you are going to be cognitively. And the last one is hit the books. So formal education, learning new things can improve your cognitive health. So taking a course maybe at a local college, a community center, a senior center, like here, like this one. I guess you guys can all check out that one, but I want you to pick a different one. So now you have to do 2 instead of 1, like I said before. Does anybody have any questions about the 10 ways to love your brain?
How many hours of sleep should you do?
They recommend that you get 8. But as you, so 8 hours of sleep a day. They said as you get older, you do need a little bit more, maybe like little naps throughout the day, but you should never nap more than, I think they said 20 minutes.
Wouldn't be that bad.
Yeah, I mean, my mom, for example, she goes to bed at like 11 and then she does not get up till like 10:30. So she's always been a person who just needed a lot of sleep and liked a lot of sleep. Even though I was like, if you get up early, you can like do more things with your day. But she's like, nah, I like to sleep. But
It's feel better when you sleep.
yeah, you feel energized and you feel rested when you get enough sleep. But also, you don't want to be sleeping too much because then you feel kind of like, groggy and sluggish too. So it's finding that right balance. And like I said before, as we get older adults maybe might take like a little 20-minute afternoon nap. And that's normal. That's 100% fine.
I was expecting to see on one of the 10 things, drinking in moderation.
Yes.
I did not see that on this sheet of paper.
Yeah, so the Alzheimer's Association probably didn't want to encourage drinking, but a part of the MIND diet, a part of that diet, they do say like little bits of red wine can be really good for you, and I've seen it all. I've seen it saying, red wine is good for you, now it's bad for you. I've seen studies on both, but for the MIND diet in specific, they say little amounts of red wine can be good for your health. But it's all about moderation, right? Again, chocolate, fried food, it's all about moderation. Because you want to be healthy, but you only live once. So it's that balance.
In a hospital setting, do you have, does the doctor order a dietitian to see the patient and say, these are the foods you should keep away from, and these are the foods you need, because you get a lot of plaque up in the brain?
Yeah, that's absolutely. So if you're in the hospital, I'm sure everybody knows that when you're admitted to a hospital, that each floor has a dietitian, and they can go and see you, kind of talk about more healthier options or diet options that they think would be better for you. So absolutely. So just to kind of like put it all together and wrap it up, so brain health overall. So one is manage your health conditions. So those chronic conditions, you want to make sure, heart disease, diabetes, all those are really well managed. You want to make sure you're taking your medications properly. everybody. And then talk to your doctor or pharmacist if you're having any bad side effects. So like I kind of talked about before, if your doctor puts you on a new medication and it's not working well, say something so then they can try maybe an alternative or try adjusting the dose. Because if it's not working for you, or has a bad side effect, no, try something else. The next one, so a healthier a person is physically, the more likely that person is to stay cognitively healthy. So the more healthier of a person you are overall, that will only do wonders for your cognitive health. All right, and then like I said before, there's no guarantee that healthy lifestyles will eliminate the risk of developing dementia, but healthy living will certainly put you in a better spot than you were before, okay? What's good for your heart is good for your brain. I've heard that saying a million times, and just keep remembering that. What's good for your heart is good for your brain. So limit alcohol, quit smoking, maintain normal blood pressure, see your doctor regularly, exercise, sleep, enjoying activities, reducing stress in your life. These are all things that can put you in a better boat to have good cognitive health for a long period of time. Okay, and these are those different wellness programs that I kind of mentioned at the beginning of my presentation. So I wanted to make sure I wasn't going too long. So these are the different wellness programs that we're offering through Milwaukee County right now. They're free to take, they're of no charge. I think some of them might have a deposit for like materials, but once you're done with the class, you get that money back, so you get that deposit back. So the first one is called Stepping On. It's a falls prevention program. So the goal of this program is to build confidence in older adults and reduce the risk of their fall so they can stay in their home for as long as they possibly can. The next one is Living Well with Chronic Conditions. So if you have 2 or more chronic conditions that you're battling or that you're dealing with right now, this helps you how to manage those simultaneously. The next one is Powerful Tools for Caregivers. So if that is for somebody who is caregiving for someone, so a husband, maybe it's their daughter caregiving for them. So this teaches you how to kind of self-manage caregiving, reduce stress, reduce guilt, and give you the tools to be a better caregiver. And then also hook you up with resources available to you in your community to help support you as a caregiver so you don't experience caregiver burnout, which happens quite often. The next one is Healthy Living with Diabetes. That's kind of self-explanatory. It helps you kind of develop skills on how to better manage your diabetes. The next one is Living with Chronic Pain. That one also teaches you skills on how to self-manage your pain. So maybe you're able to maybe cut down on those opioids or cut down on those heavy pain meds and maybe develop healthier alternatives to manage your pain. And then we do also offer a couple of different workshops in Spanish if we do have any Spanish-speaking people in the facility. So that's the Department on Aging phone number. So you can call them if you want to find out more about any of these wellness programs and kind of want to talk about joining them. You can call them and they can get you all of that information. Milwaukee County Department on Aging, that will take you to our main website too. And then once you get to that website, you type in wellness programs, it'll take you to the schedule. So it'll show you kind of where they are, how many times a day, how many times a week they meet, and how long the classes are. So I want to talk a little bit about early detection and why it's so important. So screening for dementia, much like screening for other things like heart disease, high blood pressure, things like that, it's a good way to detect changes so you can do something about it sooner instead of waiting and then all of a sudden you're in a crisis situation. So obviously the sooner you know about something, the better. So when you do an early detection memory screen, it provides you an ability to make lifestyle choice changes earlier, an opportunity to make future wishes known, so maybe get those advanced directives completed while you can still make your wishes known and what you want, what you don't want, who would you want to make decisions for you, who would you not want to make decisions for you on your behalf. You can start educating families on dementia and about caregiving so they're prepared. If you have that son or that daughter who says, Mom, I want to be there for you, Dad, I want to be there for you, I want to be your caregiver, it gives them a kind of like a head start and a chance to kind of learn about it before they're kind of maybe in over their head and they feel like they're struggling and they're in it by themselves, because no one can be a caregiver by themselves. You need a team. All right. And then it provides you with an opportunity to connect with community-based information and supportive services. So Obviously, the sooner you start, the better you are, and you can kind of learn what's out there to support you, because, you know, dementia, it's a progressive disease. It's only going to get worse, so the sooner you know about it, the better. Okay, so where to start? So all you have to do is just start, you know, one step in the right direction. So maybe start with a memory screen, maybe a physical exam, review your medications with your doctor, maybe add 1 serving of fruit or veggies or nuts or berries to your diet every day. Maybe you start like an activity journal or a food journal. Maybe find another local community center and start going once a month to a presentation, or join a club, or just any little thing in the right direction. Start slow and then go from there. Okay. So I always kind of like to clarify what the difference is between a community memory screen and memory clinics. So if you haven't already, if you would like to come and get a free community memory screen from me, and my screen is designed to detect for early signs of memory loss. It's not a diagnostic tool by any means, so by the end of my screen, I'm not going to be like, you have dementia for sure. It doesn't work that way. My tool is very easy, it's very quick to use. And it's just designed to detect for those early signs. So I just talked about the community memory screen. So the memory clinic. So in Wisconsin, we have a network of memory diagnostic clinics. So I think we have about 40 clinics located throughout Wisconsin. We have 6 locations here in Milwaukee alone, and they are designed to solely diagnose dementia and the different types of dementia. So you can always go to your primary care physician to say, I've been experiencing some memory issues, or I've been experiencing some word finding issues. I want to know about what's causing that. They can absolutely work with you and schedule the appropriate testing. But sometimes doctors don't always maybe go the whole 9 yards, but these clinics do. You don't need a primary care doctor's referral to go to any of them. And then these are the different types of things when they do their comprehensive evaluation. So they will review your history, your medical history, your diagnostic history. They'll do a complete neurological examination and a physical, a cognitive assessments, tests, and brain scans. So they'll do the whole 9 yards to figure out, you know, what is causing your dementia symptoms. Because again, it's that umbrella term, it's a group of symptoms. We want to know what is the disease that's causing those symptoms. And then lastly, these are just some community resources that I always like to highlight. So again, the Milwaukee County Department on Aging, no wrong door policy. You guys can call us at any time. The Alzheimer's Association, the Wisconsin Alzheimer's Institute, they manage the memory clinics, memory cafes, adult day centers, senior centers, and of course our dementia-friendly community work groups as well. So these are all resources specifically designed to support people who are living in the community who have dementia and their care partners. And that's my whole presentation. I wanted to leave some time for questions, but we got a little off track. I think I should wrap it up because I'm going a little bit over, but thank you guys so much for letting me come and talk to you today. It was really nice. Thanks for bearing with me. This is my biggest group that I've ever talked to, so thank you very much. And have a good rest of your day.